Hi, and welcome to the MedTalks webinar series, where you can learn from entrepreneurs, industry experts, and healthcare professionals who are all driving progress in healthcare. I'm Andrew Adaby, and in this episode, we're joined by our guest, Paul Maubach. Paul has worked in the NHS for 35 years and was previously the CEO for the Black Country and West Birmingham CCG. Now he works with organisations within the NHS and also works for the government as a senior advisor and non-executive. In this episode, we'll be focusing on the complexity of the NHS and a challenge for entrepreneurs and other vendors. The NHS is a complex system, and quite rightly so, with all its rules and regulations and governance, with multiple bodies responsible for various functions, making it a challenge at times to navigate. Some could argue the Health and Care Act of 2022 introduced the latest set of changes, such as merging NHS Digital into NHS England, while splitting Public Health England's duties amongst different organisations. You have central oversight that comes from bodies like the Department's Health and Social Care, but equally you have arm's length bodies such as NHS England, the Care Quality Commission, CQC, and local authorities also play these distinct roles. With all this navigation and trying to bring innovation into the NHS is a challenge. Let's engage. Paul, great to have you today. How are you?
Very good, thanks, Andrew. Thanks for inviting me.
As mentioned at the top of the webinar, we're going to be discussing the complexity of the NHS. Now, those who are listening to this will be interested to see, from your point of view, how things have changed over your tenure of 35 years in the NHS, particularly from your lens.
Yeah, well, it's quite amazing actually how fluid the NHS is. Actually, when I think back over my career, I started in something called a district health authority, which directly managed hospitals at the time. And those soon changed into what was called health authorities. Some years after that then changed into strategic health authorities, and that then changed into primary care trusts. That then changed into clinical commissioning groups. And we now have integrated care boards. So there's been, and that's just on one part of the NHS, which is the kind of commissioning side of the NHS. And there are kind of nuances and elements within that. But as you can tell from that, over the course of 35 years, that would be, there is quite a regular change in the way in which the NHS or components of the NHS is organised.
And actually, so now we are encountering getting used to the embedding of ICSs, but looking at the different organisations over your tenure, yes, you've got different titles, but are they all being very different or very similar in terms of what they're trying to deliver?
Well, I think the overall, the kind of purposes of them are broadly similar, but actually the way in which they go about it, I think, can be very different. So if we think about where we are now with integrated care boards and integrated care systems, that's very much all about supporting collaboration. Whereas kind of previously, there was a lot more emphasis on internal competition within the NHS. So you can see that there's been a very significant shift in emphasis, I think really to the good, really, in terms of how the NHS is now organised, in that we need to bring services out together, organise them better together with local government, with partners, and work more in collaboration in order to try and achieve the outcomes we want for the population.
As mentioned, one of the challenges as vendors is trying to understand these dynamic changes as and when they come. So for those who are listening, what is your advice to try and understand the current dynamics of the NHS?
Yeah, well, I think first of all, don't trust everyone. In terms, if anyone comes and says to you that they can completely explain the NHS to you, then I'd walk away and go and talk to someone else. So I'm now going to contradict that by telling you how the NHS is organised. But I think actually the NHS is not one organisation. It is very complicated. So if you want to understand the complexity of NHS, it's advisable to talk to different people, because they will offer different perspectives. But I think there are some sources of really useful information. So obviously NHS England, which is the main overarching body for NHS services, has got a lot of useful information on their website. So it's worth checking in there. One organisation outside the NHS, which does a lot of work with the NHS, is the King's Fund as well. They produce quite a lot of useful information. But I think what I would say is, whenever you're kind of looking at trying to understand and you go to sources of information like that, it's always worth checking them with individuals who are currently working in the system, because it's quite easy for published documentation to not be completely out of date, but elements of it or nuances of it to get out of date fairly quickly. So it's always worth going to those kind of sources, but also checking with people in the system, in the service, who are currently working in it, who understand how things currently work.
Thank you, Paul. Now, this is a bit of a difficult question because the NHS is so complex, but for those listening, can you give us an overview of some of the key elements of how the NHS is currently?
Well, I think it's probably worth trying to differentiate between two types of elements of the health service. So there's the regulatory and commissioning side of the NHS, and then there's the way in which services are organised, the provider side of the NHS, and the way services are delivered. And depending on the way, what you need to do, or the kind of things that you're interested in, or the kind of engagement you need with the NHS, so you need to think about, is it the commissioning side that I need to be looking at, or is it the provider side? Sometimes it might be both. So with the commissioning side, the basic oversight or element of it is that you've got NHS England, which is the national body, and they provide funding through to the integrated care boards. And the integrated care boards commission virtually all health services within their local area. And there are 42 of those integrated care boards across the country. They don't commission all services, so there are some services that are actually planned and organised by local government, things like health visiting and school nursing services and sexual health services. So there are some things that are done by local government, but most services you'd think about as healthcare services, like hospitals and GPs, are commissioned by integrated care boards. And then when it comes to the provider side of the NHS, you've got quite a complex mix of organisations. So you've got NHS Trusts and Foundation Trusts that deliver things like acute services. But you've got the same type of organisations that also deliver mental health services or could deliver community services. Sometimes those are in different organisations. Sometimes you have organisations that run all of those things or a mix of those things. You can also have community interest companies in some places that run some of these services. And then, of course, across primary care, you've got GP practices, your pharmacists, your dentists, and optometrists. So there's quite a complex mix of different types of organisations that are all contributing to delivering certain aspects of healthcare.
Sure, thank you for that, Paul. I mean, as a entrepreneur and a vendor myself, trying to get into NHS, it's very, very complex. Now, for anybody listening, trying to engage with the NHS, what do they need to consider before making those first steps?
Well, I'd say the first thing is it's important to try and understand, okay, the product that you're producing, or whatever it is that you're trying to do, which aspect of the health services does it best relate to? So if you're involved in something which is around the planning or prioritization of services, then that's your integrated care board. If it's something that is perhaps a completely new way of doing things, then actually integrated care boards might be interested in that. But if what you're doing is largely geared around ways of working, or processes, or new treatments, then you need to be thinking about, well, do I need to engage acute hospitals in that, or is it general practice that I'm working to? But you need to think about your products and what type of interventional it is, and therefore which type of organisation does it best relate to. That's the first thing I think you need to think about. The second thing is that be very much aware that the NHS does not operate like a new startup or a kind of small organisation. The NHS is predominantly they're public sector organisations, they're public bodies. And as a public sector organisation, you've got to be you're clearly accountable for how you make your decisions and how you spend resources to the public. So there's quite significant processes and decision-making processes that public sector bodies have to go to consider making changes to the way they operate. And if you think about it, from a public point of view, if you're going for a treatment in a hospital, you want to know that that service is as safe as it possibly can be. Well, the only way services become safe is if there's really rigorous testing, there's really rigorous rules and procedures, control mechanisms, and clinical decision makers around how services are organised. So NHS organisations necessarily are very significant bureaucracies which take time to make decisions because they need to make sure those decisions are made in the right way. So if you're a small organisation that's trying to interact with NHS organisations, bear in mind that they make decisions in a very different way to you. And that's going to require a degree of patience and resilience in order to be able to engage with that. And the other thing I would think it's important to bear in mind is that if once you've engaged with one organisation in the NHS, you've just engaged with one organisation in the NHS. Yeah, and it's even if you think you've got the most fantastic product in the world, you're going to need resilience to be able to engage with multiple organisations. I always think the best way to demonstrate the kind of effectiveness of any product that people develop is to work closely with one or two organisations, develop the product well with them, and they then become your biggest advocates for why other organisations might be interested in taking that on. So I would advise kind of looking out and finding allies that you can work with and collaborate with and develop the service you're trying to offer or the product you're trying to develop. Make sure that make it work with them, and then help them to demonstrate that effectiveness to other organisations.
Absolutely, and with some personal experience of some of the vendors in the startup space, you touched a point there about time, and there is no holy grail number in terms of duration, how long it takes to get to NHS. It's not an arbitrary 6 months or an arbitrary 1 year. The fact of the matter is that resilience and the patience, because you have to realize that there's always a mismatch between what vendors want and what the NHS is capable of delivering. However, those who are resilient will ultimately want to be successful.
Yeah, I think resilient. First of all, you need to be resilient because these things take time. I think the other thing that you need to do is be consistent as well. So, be clear what it is that what you're offering can deliver, and stick with that. I think it's obviously something you need to be adaptable, but actually, the clearer you can be about what it is that you think you can offer, and the more consistent you can be with that, the more likely you are to then get traction with organisations. If you keep kind of changing the message or saying, well, we could do this or we could do that, or it could evolve to this, then actually an organisation is going to be looking at saying, well, what actually is it that you're offering then? So I think it's really important to be clear about what your kind of USP is, what your unique offer is, and then stick with that until you get traction on it.
Absolutely. So I mean, that's great advice to some of the vendors who are listening here. So clarity of your USP is important, but what other suggestions could you have in kind of overcoming some of the challenges you would face coming into the NHS?
Well, I do think that you need to kind of understand how what you're providing can add value to what's already exists. So it's really important to understand. You not only need to understand your product, but you need to understand the context within which it's delivering. So so if this is a product you're providing support, for example, into a GP practice, you need to understand the current ways of working and of that practice, and how this product can interact and engage with what they're already doing, or how it can enhance what they're already doing. So you shouldn't be thinking about what you're doing in isolation. You need to be thinking about it in the context of the organisations that you're trying to engage with. I think the other thing is it's really important to be clear about to look at what the organisations like NHS England are saying about what the direction of travel is, what the expectations are around the kind of things that the NHS is looking to improve on. So what are the priorities for the service at the current time? Does your product or what you're trying to do fit with that or not? The more that the product you have aligns with the current priorities of the NHS, the more likely you are to be successful. I think the other thing that I would recommend, which I kind of said near the start, is that don't rely on the views of just one person, because the NHS is so complicated, and there's many organisations in the NHS, but also many different ways of working. There's many different services. I'd advise that it would be advisable to try and make contact with a range of different individuals who have got different knowledge or skills or different experiences within the NHS to help them, so that they can help you understand the context of your product. No, it'd be very rare to find just one individual that can help you relate to all the different complexities of how what you're offering might relate to the NHS. So you need to be consistent, like I said before. You need to be resilient and prepared for the fact that this takes time. But I would also advise talking to a kind of wide range of individuals. And one of the best ways to do that is to go to things like conferences and meet people in conferences. Go and listen to people who are talking in the area that you're developing in, and get their advice about how what you're doing relates to that agenda. But go take time. You need to take time to go and meet different people and get their help them to give you a perspective on how what you're doing relates to the way the NHS currently works.
Paul, in terms of a final question, what I'll be interested from your point of view is a kind of a temperature test of the NHS at the moment. Darcy indicates that the last 14 years have been a real challenge, but I wonder what the 10 years will look like going forward for the NHS, and in particular for vendors who are trying to bring innovation into the market.
It's a very good question, Andrew. Well, I think you should be optimistic about it, because one of the fantastic things about the NHS is it's a universal service, and the scope of what the NHS does is huge, but it's also constantly looking to evolve and improve and deliver better outcomes for the population. And if you think about the current national policy drive, there's a strong emphasis on 3 shifts from hospital to community, from treatment to prevention, and from analog to digital. So if the services or the products you're offering relate to those 3 agendas in any way, then actually, why wouldn't the NHS be interested in talking to you to understand how you can contribute to enabling that movement forward? So, and the future NHS is one which is going to be more technically driven. It's going to be more personalised, but it's also going to be responding to ever more complex needs. And the NHS is going to need more innovative solutions to help meet the ever rising demand on it. So I would be optimistic, even though the current financial climate is quite challenging. I would be optimistic that if you've got products and services that can engage and support the NHS in that agenda, then I would encourage you to press on and look forward to seeing them being available to people in the future.
Fantastic. Paul, it's been great to have you on this episode. We look forward to welcoming you onto MedTalks at some point in the near future. Thank you.
Thank you.
If you enjoyed today's episode, subscribe to the channel and share it with someone who might find you useful. You can find all the resources we talked about today in the notes, either on TikTok, X, LinkedIn, or YouTube. Whether it's morning or afternoon or evening, where you are, thank you for tuning in. Let's keep the curiosity alive, and together, let's work towards a better healthcare for everyone. Goodbye.